In today's video, we're going to be talking about Qelbree or viloxazine, which is a non-stimulant medication for the treatment of ADHD, so stay tuned. So let's start with talking about what is Qelbree. Well, Qelbree is a selective norepinephrine reuptake inhibitor. So it's going to increase norepinephrine and also to a lesser degree dopamine in the prefrontal cortex. And as you recall on the video that I just did on Strattera, you'll recall that there are more norepinephrine transport systems in the prefrontal cortex versus dopamine transport system. And dopamine has a greater affinity for these norepinephrine transport systems. So when you block the reuptake and release of norepinephrine, you're also blocking the release and reuptake of dopamine, allowing for both dopamine and norepinephrine to be available in the synapses for your brain to use. Now, when you increase dopamine and norepinephrine in the dorsolateral prefrontal cortex, this can help improve attention, concentration, executive function, and even wakefulness. And when you increase this in the medial prefrontal cortex, this can actually help with depression. And again, it's also important to note that too much norepinephrine release in this area of the brain can actually lead to sedation and even cognitive impairment. So if you're experiencing this as a side effect, it may be best to decrease the dose. And Qelbree actually comes in extended release capsules in varying dosages. But these extended release capsules can actually be opened and sprinkled on your food because it's the beads inside those capsules that actually make it extended release. So you wouldn't want to crush or break open those beads, just the outside capsule. And so what is Qelbree used for? So Qelbree was actually approved by the FDA in 2021, and it's approved for the treatment of ADHD in adults and children ages 6 years and older. Off-label uses for Qelbree include major depressive disorder and even treatment-resistant depression. And so how long does Qelbree take to work? Well, this is one of those non-stimulant medications where it doesn't really work upon the first dosing, and it actually takes a gradual onset in order for you to start to notice its benefits. And the onset of the results that you see, or when you start to see efficacy of the medication, starts in 1 week, but then gradually improves over 8 weeks. So by 8 weeks is when you should see the max benefits of Qelbree. So if you're on a therapeutic dose of Qelbree and you're not seeing max benefit, then you should probably switch to another medication. And these therapeutic doses will actually vary by your age. And so therefore it's important to talk to your doctor to make sure that you're on a therapeutic dose. And if you are on a therapeutic dose and you've been on it for 8 weeks, then consider switching your medication. And so is Qelbree addicting? Well, no, it's not addicting. And in fact, that increase in dopamine that occurs in the brain is not happening in the mesolimbic area of the brain because there are no norepinephrine transport systems in that area of the brain. And it's the dopamine release in this area of the brain that makes stimulant medications addicting due to cravings and the potential to want more and more because you're enhancing that reward effect that you get when taking something that enhances dopamine in this area of the brain. But because Qelbree doesn't work in this area of the brain, there is no risk for abuse and therefore it's not addicting. However, adverse reactions have been reported when stopping Qelbree abruptly, and so therefore it's important to make sure that you taper off slowly. And some of these reactions include things like somnolence, nausea, irritability, headaches, tachycardia, fatigue, and even decreased appetite. So again, just make sure that you taper off slowly and make sure you're working with a provider who knows how to taper you off medications safely. And so that brings us to the side effects. What are the common side effects of Qelbree? Well, the side effects of Qelbree were actually divided by pediatric and adult population. And so the most common side effects experienced by the pediatric population are the following: somnolence, decreased appetite, fatigue, nausea, vomiting, insomnia, and irritability. Now, the most common side effects in the adult population are the following: insomnia, headache, somnolence, fatigue, nausea, decreased appetite, dry mouth, and constipation. And so what about those warnings and precautions with Qelbree? Well, there is the black box warning for suicidal ideation, and this was actually seen in both the children, pediatric, and even adult population. In the pediatric population, the risk noted was 0.9%, and the adult population was 1.6%. So therefore, make sure you're being monitored for the risk of suicidal ideations, and if you're having thoughts of suicide, that you go to an emergency room, because that is an emergency and should be taken seriously. Also, because you're stimulating norepinephrine, you may get increases in blood pressure and heart rate, and therefore your blood pressure and heart rate should be monitored while you're on this medication, as well as take note that cardiovascular events can occur, and make sure that if you have cardiac abnormalities or tachyarrhythmias or arrhythmias, that you're cleared by a cardiologist before starting Qelbree. Also, activation of mania or bipolar have been reported, and so make sure that you're evaluated for any symptoms of psychosis or bipolar mania, and even a family history can put you at greater risk for this. And also, if you're a patient who has bipolar, it's going to be important that your mood is stabilized for quite some time before starting a medication for ADHD, whether it's a stimulant or a non-stimulant medication. Now, non-stimulants do have a lesser risk or lesser degree of this risk occur than the stimulants, but still it's something to consider. Also note that somnolence and fatigue were reported, as I mentioned, in the most common side effects. And so if this is something that's occurring with you, you may consider either decreasing the dose or taking the dose at night, because again, it's cumulative effects, so it can be taken once daily and at night if this is a problem for you. And so if it is affecting you in that way, like making you feel too tired or somnolent, then it's important that you don't operate machinery like driving a car. So what are those drug interactions with Qelbree? Well, Qelbree is actually metabolized by the CYP2D6. However, it is also a strong inhibitor of the CYP1A2, and then it's a weak inhibitor of the CYP2D6, and also a weak inhibitor of the CYP3A4. So the big disadvantage with Qelbree is that there's going to be many drug interactions. And so you really have to make sure that you're doing your drug interactions check if you're taking Qelbree, and I'll make sure to go ahead and put a link in the description so that you can go ahead and do that on your own, or ask your doctor to make sure that they're checking for drug interactions, because as you can see with this list, there are many drug interactions, and this is just the list of very severe drug interactions. There are a ton of moderate drug interactions and even mild drug interactions that can occur when taking this medication. So just be aware of that. You also want to make sure that you avoid the use of those MAOIs. Those monoamine oxidase inhibitors are contraindicated in combination with taking Qelbree, and so you want to make sure that you have stopped your MAOI medication at least 14 days before starting Qelbree. And also remember that alcohol is a depressant and will actually do the opposite that Qelbree is trying to do. So Qelbree will not be very effective, and so therefore alcohol is not advised. But also note that it can be taken with food. Like I mentioned earlier, it can be opened up and sprinkled into food, and that's especially true for pediatric patients and children that don't like to swallow pills. And so what are my final thoughts on Qelbree? Well, those stimulants are actually first-line treatment for ADHD. But though those stimulants are considered first-line treatment, a lot of people can't tolerate stimulants. And so you have to look at non-stimulant options like Qelbree. However, as I just went over, there are many side effects to consider, warnings, contraindications, etc., that you have to weigh out when considering taking a medication like Qelbree, and therefore weigh out your risk versus your benefit. Also, it's important to note that you develop skills and try to use skills before even going to pills. So seek out a therapist that knows how to treat ADHD to help you manage your time and also organize things so that you're more able to focus on your schoolwork or work in general. It's also important to note that Qelbree is actually still branded. And so if you don't have insurance, you're going to have to pay a lot out of pocket to start taking Qelbree if this is something you want to try. If you do have insurance, you may have to jump through some hoops, but you're going to want to go ahead and look at their website, look at their savings card, and see if that's something that you could take advantage of to help decrease your costs. So there you have it. That is my overview on Qelbree. Do you have experience taking this medication? If so, drop it down in the comment section below because we learn from sharing each other's experiences. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.